13 Early warning signs and symptoms of HIV. When you don't feel well, you go to the doctor, you get regular dental health checks, but have you thought about your sexual health? Sexual health is important, and not practicing safe sex can lead to some serious health problems. Everyone should take responsibility for their sexual health by getting regular checkups and practicing safe sex, to lessen the risk of getting a sexually transmitted infection or an unplanned pregnancy. Safe sex tips. Prevention is better than cure where sexually transmitted infections and unwanted pregnancies are concerned. Here are some tips to reduce your risk. Always use a condom. The pill can prevent pregnancy but not an infection, so a condom is the best way to protect yourself. Be vigilant about any possible signs and symptoms of an infection so you can get it treated and don't spread it to your partner. Get regular sexual health checks, as some infections can damage fertility and cause other health problems if they are left untreated. Also, remember that it is possible to have an infection and have no symptoms. Common sexual health problems. Sexually transmitted infections are passed from one person to another through unprotected sex. Here are some of the most common infections. Chlamydia. This is a very common infection which tends to cause lower abdominal pain when urinating or bleeding after sex in women, and in men, it can cause a discharge from the penis and pain in the testicles. Often, the infection doesn't have any symptoms, and if it is left untreated, it can damage your fertility. Chlamydia is usually treated with antibiotics. Genital warts. Genital warts are small fleshy growths around the genital area, which are caused by the human papillomavirus. The warts might not be painful but they can itch. They are treated by topical lotions or creams, or they can be frozen off. Genital herpes. Genital herpes is caused by the same virus that causes cold sores. Symptoms of herpes tend to appear a few days after exposure to the virus. Blisters develop in the genital area, which can itch and they can make urination painful. The infection can lie dormant in the body and be triggered again, as there is no cure. Antiviral medications can be used to control symptoms. Gonorrhea. Gonorrhea is a bacterial infection which can have no symptoms. When the condition is symptomatic, it can cause painful urination, a yellow or green vaginal discharge, and bleeding after sex in women, and in men, it can cause painful urination, discharge from the penis, and pain in the testicles. Gonorrhea is treated with antibiotics, but if it is left untreated, it can cause infertility. Syphilis. Syphilis is a bacterial infection that initially presents itself in infectious sores around the genitals or mouth. Other symptoms then appear, such as flu-like symptoms and hair loss, and this eventually can lead to heart problems and blindness. The infection is diagnosed with a blood test, and is treatable with penicillin. If it is fully treated in the early stages, this can prevent the more serious later stage problems from occurring. HIV. HIV is passed on through having unprotected sex, or sharing needles to inject drugs. The virus attacks the immune system, so it is unable to fight off infections. Medication available now can help most people to live as healthy a life as possible. When the infection has developed to the extent that the immune system can't fight off infection at all, this is called AIDS. HIV often begins with symptoms like fever, a sore throat, or a rash. A blood test or saliva sample can diagnose HIV. Trichomoniasis. Trichomoniasis is caused by a parasite. It is passed on through unprotected sex. It causes a frothy, foul-smelling discharge from the vagina and soreness when passing urine in women, and men rarely have symptoms. The infection can be diagnosed with a swab test and is treated with antibiotics. HIV. HIV stands for Human Immunodeficiency Virus. There is no cure, but there are treatments to help people live longer and stay relatively healthy. HIV weakens the immune system so that the body can fight off infections. Most people who receive treatment for HIV won't go on to develop AIDS. How is HIV spread? HIV is passed on through sexual contact and it can affect either homosexual or heterosexual people. HIV can be passed on through contact with the blood, semen, vaginal fluid, or even the breast milk of an infected person. Common ways that HIV is transmitted from one person to another: having unprotected sex, sharing needles with an infected person, intravenous drug users for example. A pregnant woman with HIV can transmit the virus to her baby. You can contract HIV from hugging, kissing, sneezing, sharing cutlery and plates, or from toilet seats. Initial symptoms of HIV. Most people start to experience symptoms such as a sore throat, fever, and a rash a few weeks after they have been infected. The only way to tell if you have contracted HIV is by having a test. It is important to get a test as soon as possible if any of the following apply to you. You have recently had unprotected sex with a new partner. A partner or former partner tells you that they are HIV positive. You have shared needles or had a tattoo without a sterile needle. How is HIV treated? Emergency HIV drugs. These can be used to prevent infection within 72 hours of possible exposure to the virus. Treatment is not simply a one-off pill, it is a month-long course of drugs which have side effects and are not guaranteed to work. If you test positive for HIV, you will need to have blood tests at regular intervals to check how the infection is progressing. You will not normally be started on any treatment until your body's immunity has reduced past a certain point. The marker for this is the level of CD4 cells in your blood. These cells are important in helping to fight infection. If your cell count is 350 or below, you will usually be started on treatment. Antiretroviral drugs. These drugs stop the virus replicating and causing further damage. More than one type of drug is usually needed, as the virus can easily become resistant to a single drug. Most patients use 3 or more different drugs. These drugs can be combined in a single pill nowadays, however. Most patients will need to take these drugs for the rest of their lives. These medications have side effects which include nausea, diarrhea, rashes, and sleep problems. 14 Signs and symptoms of HIV. If you believe that you may have been exposed to HIV, here are some early signs and symptoms of infection to look out for. Fever. This is usually one of the first signs of infection. It is usually accompanied by fatigue, swollen glands, and a sore throat, not dissimilar from the flu. This symptom usually occurs a few weeks after exposure to the virus. When you get these symptoms, it's a sure sign that the virus is in the bloodstream and it's replicating. The symptoms are caused by the immune system's reaction to the virus. Fatigue. The immune response to the virus can make you feel tired and lethargic. In the later stages of HIV infection, fatigue is debilitating because the immune system is overwhelmed. Aching muscles, joint pain, and swollen lymph nodes. Early HIV infection can be mistaken for the flu, as the symptoms are very similar. It is also often misdiagnosed as mononucleosis, or hepatitis for the same reason. The lymph nodes are part of the immune system and become inflamed when there's an infection present in the body. Most of the body's lymph nodes are in the armpit, groin, and neck. Sore throat and headache. These are quite vague symptoms, but they can present as an early sign of HIV infection. At this stage, symptoms are mild, so HIV might not show up in a blood test. It can be months before the antibodies show up in the blood. If you have recently had unprotected sex or have otherwise engaged in risky behavior, and you start getting these symptoms, it might be worth getting them checked out to be on the safe side. Skin rash. A skin rash can be an early and advanced stage sign of HIV infection. The rash can appear anywhere, but especially on the trunk and arms. It can appear like boils or sores on the skin that don't heal. If you can explain the rash or it looks unusual, get it checked out to make sure. Nausea, vomiting, and diarrhea. Between 30 and 60% of people with HIV infection have nausea, vomiting or diarrhea in the early stages of infection. The antiretroviral medication can also cause these symptoms, as can infections you might pick up due to a weakened immune system. Diarrhea that carries on for a while and doesn't respond to the usual treatments can indicate HIV and/or a weakened immune system. People with strong immune systems can usually fight off infections that cause diarrhea quite quickly. Weight loss. Weight loss in the initial stages of HIV infection is not uncommon, but it is more common when the illness is more advanced. Weight loss is generally a sign that the immune system is compromised, as the body uses up a lot of energy trying to fight the infection. If you are losing weight despite continuing to eat a reasonable amount of food, this is a classic sign of advancing illness. If a patient has lost more than 10% of their body weight, it is a clear indication that the infection has progressed considerably. Dry cough. A cough can be irritating, and at first can be put down to having a cold or an allergy. But when it carries on despite treatment, and for an unusual amount of time, consider having an HIV test. A cough coupled with weight loss is a concern, and is often the sign of having a bug that a normal immune system could fight off. When the immune system is depleted, infections can come along and take hold in the body unexpectedly. A cough can be a sign of an illness like pneumonia, which can be fatal in people who are immunocompromised. Night sweats. About 50% of people experience night sweats during the early stages of infection. As the infection progresses, almost all patients will get them. The sweats are similar to the hot flushes that are experienced by women going through the menopause, and they will often be so profuse that they will soak your bedclothes and sheets. Nail changes. Changes in the nails might occur, such as thickening, curving, splitting, or discoloration. These changes can be due to fungal infection. If your immune system is compromised, such infections will find it easier to take hold. Yeast infections. Yeast infections are caused by Candida, which is a very common fungus that is ordinarily easily fought off by the body. If you have HIV and the immune system is compromised, you might find that you are more susceptible to these types of infections as the body is not able to fight them off. Look for signs of thrush, including white patches on the tongue or on the inside of the cheeks. Cold sores or genital herpes. Both are signs of an HIV infection. Having genital herpes can increase your risk of contracting HIV in the first place, as the ulcers and blisters caused by the virus can make it easier for the HIV virus to enter your body. If you have HIV, the immune system will be weaker than that of the average person, so any outbreaks of infection or illness will be generally a lot more severe and complicated. Menstrual problems. Being infected with HIV increases the risk of experiencing menstrual problems. Periods will often be lighter, and happen less often. Though this is often what happens when a woman is in poor health or has lost a considerable amount of weight. Mother Nature decides that you are not fit enough to sustain a healthy pregnancy, and so your body reserves its energy for essential functions and menstruation slows or ceases. Women infected with HIV tend to go through the menopause a lot earlier than average. Final thoughts. Sexual health can be an awkward and embarrassing topic to talk about, but it's essential that we take ownership of our sexual health. Taking risks and assuming that everything will be fine can seriously backfire. Having unprotected sex, even just once, can result in unwanted pregnancy, sexually transmitted infections, and a whole host of other health problems. Some people feel that there is a stigma around buying condoms, but they really are the best method of protection against infection and pregnancy. You can often get them for free from a family planning or sexual health clinic. Practicing safe sex and getting regular health checks are important steps we can take to look after our sexual health. We can also make sure that we don't engage in risky behavior, such as having unprotected sex with a partner whose sexual history we aren't aware of. Sexually transmitted infections are usually easily treated with antibiotics, but they can be very unpleasant. They can cause symptoms such as unusual discharge, painful urination, and abdominal pain among others, and if they have symptoms at all. Some infections do not cause any symptoms, but can have long-lasting effects on fertility and general health. HIV is a very serious sexually transmitted viral infection which can destroy a healthy immune system once it invades the body. HIV is no longer the death sentence it was a few decades ago, since there are now antiviral medications that can help boost the immune system and stop the disease progressing. Most people who are diagnosed with HIV now will live a long and relatively healthy life. They must take the medication for the rest of their lives though, and the medication is not without side effects. The infection is spread through sexual contact and exposure to the bodily fluids of an infected person. It can be spread through blood, semen, vaginal fluids, and even breast milk. There are a lot of myths around how HIV can be spread, and a lot of these emerged during the hysteria of the 1980s when the infection started killing a lot of homosexual men. The disease is just as likely to occur during heterosexual contact, however, and you can catch it from hugging, from sharing towels or utensils, or from a toilet seat. There is no cure for HIV, but the disease is more well understood nowadays. There are some signs of HIV infection that we should be aware of, especially if we have engaged in risky behavior. Early warning signs of infection include a sore throat, fever, fatigue, and a skin rash. These could easily be signs of something else, but it's better to be safe than sorry.